Today we will discuss about the side effects of the analgesic drug. In the previous class, we studied about the analgesic effects. The content of this PPT is purely for the education purpose only. The content is taken from the book of pharmacology and internet sources. Objective and definition of the analgesics and side effects of the analgesic. So, analgesics, a drug that technically relieves pain by acting on the CNS or peripheral pain mechanism without significantly altering consciousness. Pain and unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. So, classification of the two drugs, opioid analgesics, that is narcotics, morphine-like analgesic drugs, non-opioid analgesics, that is acid, non-narcotics, aspirin-like analgesic drugs. History of the opioid derived from the poppy papaver somniferum capsules called opium, known as the earliest time, mentioned in the Ups Papias, that is 1500 BC, and in the writing of the or of Rhesus 300 BC and Galen 2nd century AD. Saturner, a pharmacist, separated the active principles of the opium in 1806 and named it a morphine after a Greek god of the dreams, Morpheus. So, natural opium alkaloids are morphine and codeine. Semi-synthetic opioids are di diacetyl morphine, oxymorphone, and polycodeine. Synthetic opioids such as pethidine, phenadine, methadone, dextropropoxyphene, and ethoheptazine and tramadol. So, non-analgesic and anti-inflammatories are non-selective COX inhibitors, so salates, aspirin, salicylamide, benylines, diphenols, parazolone derivatives, phenylbutazone, oxyphenylbutazone, propionic acids derivatives, ibuprofen, naxoprofen, ketoprofen, phenoprofen, oxypazone, indole derivatives, indomethacin, succinyldac, and anthelinic acid derivatives, morphine and acidic acids, and flufenamic acids, acryl acetic acids derived from diclofenac, and toluene oxime derivatives, that is pyroxicam and tenoxicam, pyrrole, pyrrole derivatives, that is ketorolac. Preferential COX-2 inhibitors are nimesulide, meloxicam, nebutamine, and selective COX-2 inhibitors are valdecoxib, celecoxib, and rifacoxib. Analgesic with poor anti-inflammatory action such as the paraminophenol, the derivatives, paracetamol, acetaminophen, there is the parazolone derivatives, that the metamizole and profenazone, and benzoxine derivatives, that the nefopan. Pharmacological actions such as CNS depressant and stimulant actions, cardiovascular cause of vasoresistance, GIT, constipation. These are the side effects. The smooth muscles thus increase ureter contraction and bronchoconstriction, that is ANS, mild hyperglycemia. So, analgesic doses are usually, this is the adverse effect. Analgesic doses are usually well tolerated, but anti-inflammatory doses are usually associated with the adverse effects with users for the long period of time. Examples are GI tract, that epigastric distress, nausea, vomiting, erosive gastritis, peptic ulcer, increases occult blood loss in stool are the common. As secondaries, allergic reactions are not common but may be manifest as a rash, photosensitive, etc. And there is the hemolysis there, nephrotoxicity there, Reye's syndrome, salicylism, and acute salicylic intoxications. These are the side effects of the analgesic drugs. The function of the analgesics, what are they are doing in the body? Analgesics often prostaglandin induce hyperglycemia by affecting the transducting properties of the free nerve endings stimuli. normally do not elicit pain are able to do so. NACIDs do not affect the tenderness induced by direct application of the prostaglandin, but they block the pain sensation mechanism and induce the bradykinin. So, what is an antipyretic? NACIDs lower the body temperature in the fevers, but do not cause hypothermia in non-thermic individuals. NACIDs block the action of the pyrogenes, but not that of the PGE2 injected into the hypothalamus. So another uses of the ibuprofen. So this work as an analgesics and antibiotics. We can use this drug in rheumatoid arthritis, osteoarthritis, musculoskeletal disorders, that is soft tissue injuries, fractures, vasectomy, tooth extraction, postpartum, postoperative, suppresses swelling and inflammation, and doses are available in the form of 400 and 800 milligram tablets that can be given in TDS, commercially available as a brufen, inflame ibuprofen, and that is available in 200 and 400 milligram tablet. Ibogesic, again, this is another drug which is used, can be given in the form of BD or TDS, and that is available in the market 100 milligram, 100 milligram tablet. Adverse effects of the analgesic effects are that they are going to give you constipation, drowsiness, dizziness, upset stomach, ringing is in your ear, skin itching or rash, dry mouth, aggression of the asthma, and heartburn. So these are the side effects of the analgesic drug. Diclofenac sodium, the uses are that is aryl acetic and acid derivatives well absorbed orally. Plasma life and half-life of this drug is 2 hours. Adverse effects are epigastric pain, nausea, headache, dizziness, rash. Uses this again can be used in rheumatoid arthritis, ankylosing spondylitis, dysmenorrhea, post-traumatic and post-inflammatory conditions. Doses in 50 milligram tablets that is given in TDS. Then BD, and that is available in 75 milligram, and deep intramuscular injections are also given. So diclofenac, it is again very commonly used in case of the acute pain, commercially available as in Voveron, Diclofenac, Movon, Movonec 50 milligram tablets, and Diclomax 25 and 50 milligram tablets. Side effects of this drug, diclofenac sodium, is constipation, drowsiness, dizziness, upset of the stomach, ringing in your ears, skin itching or rash, dry mouth, aggression in the stomach, and heartburn. These are the side effects of the drug diclofenac sodium. Another drug, very important, that is called nimesulide preferential FOX2 inhibitors used for the short-lasting, painful inflammatory conditions like sports injuries, sinusitis, ear and nose throat disorder, dental surgeries, bursitis, low backache, dysmenorrhea, post-operative pains, osteoarthritis, for the fever and for fever, completely absorbed orally excreted in urine. That is half-life of this drug is 2 to 5 hours. Adverse effects of this drug, nimesulide, is epigastric, heartburn, and nausea, loose motions, rash, pruritus, hematuria, fulminates, hepatic failure in few cases, useful in asthmatic bronchospasm, intolerance to aspirin and other acids. So doses available in 100 milligram tablets, commercially available as in the market, Nimolid, Nimogesic, Nice, Novel, Nimodol, and 100 milligram tablets. So, conclusion, the analgesics are definitely useful in reducing the painful and improving the quality of the life, but have their own spectrum of the adverse effect. No single drug is superior to all the others. Every patient's choice of drug is inaccessible and empirical. So, summary of this, we have concluded this drug, including the introduction part of the analgesics and side effects of the analgesic drug. So the reference of the book is from the KD Tripathi, JP Publishers, Delhi. And thank you.